Hey there, everybody. It's Dr. Jay Harness from Breast Cancer Answers. And welcome to this live broadcast and broadcast interview that we're doing today on our Facebook page for Breast Cancer Answers. As many of you know, I'm the co-founder and medical director of Breast Cancer Answers. For those of you not familiar with the site, please check us out. We've got over 1,300 videos with over 11.4 million views of our videos. And the videos are really designed for breast cancer patients, their families, and others. Today is a unique treat for me. We're going to be talking today and in the future interviews with Dr. Gordon Saxe. Gordon is both an MD and PhD. He is the executive director of the University of California, San Diego Center for Integrative Nutrition, and he's also the chair of research for the Krupp Endowment. But what makes this really, really special for me is that I had the opportunity to meet Gordon when he was working on his PhD at the University of Michigan in the mid to latter part of the 1980s. I was the director of the breast center at the University of Michigan. Gordon came to me and said, "Gee, Dr. Harness, I'd like to work on calorie counts and calorie consumption in breast cancer patients." And I kind of thought, well, okay, why not? And Gordon went ahead and finished his PhD at the School of Public Health, University of Michigan, and then went on to get his MD degree at Michigan State University, and through the years has ended up here on the West Coast at the University of California, San Diego. I won't bore you with a long story about how we managed to reconnect, but it's just been an amazing reconnection. So Gordon Saxe, here we are 30 some years later doing a live interview on Facebook. So welcome.
Thank you. And I just want everybody to know you haven't aged a day, Jay.
Gordon, thanks very much. So our big subject is going to be food as medicine. And as you and I have discussed not only yesterday, but recently, this is a really huge subject, obviously for patients who are newly diagnosed with cancer, for patients who are who have a strong family history and may want to help nutritionally to prevent cancer, patients who are in active treatment. I mean, there are all sorts of different phases of how this subject gets put together. But Gordon, why don't you start off with sort of the big picture of how food fits into the whole approach to patients with any kind of cancer?
It's been known for, maybe a century that dietary changes with lab animals can influence the growth of cancers in lab animals. And since probably the early 1960s, there's been growing amount of data in human populations showing striking correlations across countries in the world between dietary patterns and the risk of developing the common chronic cancers that we're so familiar with: breast cancer, prostate cancer, colon cancer, and so forth. So,
okay, all right, very good. So I've often said to patients and to people when I give lectures and whatever, the highest incidence of breast cancer in the world is in Western Europe, United States, Canada, Australia, New Zealand. Maybe you could elaborate about what we have in common and what's different, but obviously one of the things I think we have in common is a lot of food in those locations.
Yeah, the dietary pattern in the countries you've described is not identical, from one country to the next, but it bears a lot of similarity, and it's strikingly different from the kind of dietary pattern you see in countries that are at lowest risk. And by the way, when I refer to lowest risk for prostate cancer, there is a roughly 100-fold difference in the risk of developing invasive prostate cancer in a man from the United States, particularly certain regions in the United States, versus a man who lives in the province of Qidong, China.
Huh. Wow. And has research given us any clues at all, Gordon, as why that might be the case?
Well, there's been a number of studies going back also probably to the 1960s, showing that people who migrate from countries that are at very low risk, for example, China, Japan, and so forth, when they migrate to high-risk countries like the United States, the migrants themselves have a huge increase in their risk of those cancers. Yeah. And then their children, even if it's, say, a Japanese woman, Japanese man, there is no Caucasian genetic influence in there, their children have roughly the same rate as Caucasian Americans.
So clearly, diet, especially our Western diet, really plays a role yet to be elaborated in the development of different cancers. We've often said that Asia, as an example, that Asia has had one of the lowest incidence of breast cancer. Probably the same is true of prostate cancer. But what's been fascinating when I talk to my Japanese colleagues and when I've lectured in Japan is that the incidence of breast cancer is going up the more westernized the diet has become in Japan. Fair enough?
Correct. And if we look at the rates of breast cancer from several decades ago, from say the 1960s or 70s until today, we see that what was once a very rare disease, breast cancer, has become not as common as it is in the United States or Western Europe, but it's definitely increased. And Jay, the most striking example probably comes from China. There's a researcher named Colin Campbell who, from Cornell University, who did a large study with Oxford and the government of mainland China. And he wrote a book on it called The China Study. And in that book, he describes that when you look at people who live in rural China, who have dietary patterns that are, similar to what they were in all of China, maybe 30, 40 years ago, and you compare that with the people in Shanghai, the urban dwellers in China, in those urban areas, the diets have changed, have westernized considerably, and the rates of cancer and other diseases have skyrocketed. And there are dramatic differences within China, and clearly they can't be accounted for by, say, differences in genetics or in the racial stock of the population or ethnicity. They're clearly related to something in the environment. And when we drill down even further, we see that the likely culprit has very much to do with diet.
Wow. So we literally, Gordon, are what we eat, aren't we, huh?
We are strongly, there are influences beyond diet. Certainly, there are environmental factors, physical activity, our psychological makeup and stress and things like that can strongly influence health. But I tend to think that diet is perhaps the singularly largest factor. And I kind of hang my hat there because it's one that we can more easily influence. You may have a really difficult boss at work who's always yelling at you and you've got tons of stress, or whatever, but you can't necessarily just quit your job as much as you might love to, as therapeutic as it might be. But one thing you can do, at least, to some extent, is you can begin to work on making healthier dietary changes at home.
Fantastic. Listen, this is beautifully set the stage, if you will, for today's interview and our future interviews. Now, when we were talking yesterday and getting ready for today's interview, you talked about where food fits into the overall therapeutic approach. Do you want to elaborate on that? And then maybe as we agreed today, we'd probably do 15 or 20 minutes and we'll get more specific later on. But big picture wise, how does food fit into the overall therapeutic approach? And we don't want people thinking, oh gosh, food is the substitute for what are known as standard of care treatments.
Yes. So several years ago, I was running a conference at University of California, San Diego, UCSD, and it was on integrative oncology. And I was trying to help frame the discussion and the overall approach of the conference to help people understand the importance of food as medicine and where it might fit in. What I drew upon were my own experiences studying the epidemiology of cancer and other diseases, as well as some of the ancient healing systems like Chinese medicine, Ayurvedic medicine. And at the end of the conference, a a faculty member from Bastyr University, the largest school of naturopathic medicine in the US, a faculty member who was in attendance at the conference, came up to me in tears. And she said to me, "You may not realize this, but your overall program for this conference essentially embodied a core concept in naturopathic medicine called the Therapeutic Order."
Huh.
It was the first time I learned about or heard about this concept, but I lived and breathed it because it intuitively made so much sense. And you saw it essentially in the fabric of Chinese medicine and ancient healing systems. What it says is that under most circumstances, where not an emergency, that's a different situation, an acute emergency, or crisis, but when things are stable, the order in which we roll out therapeutics to help patients with health problems starts with a foundation in which we establish the conditions for health. We have to build good, strong soil, and the primary factor for that is diet. Now, of course, physical activity and other healthy lifestyle factors also fit in, but probably the anchor there is dietary change.
Wow. Wow. Let me just interrupt for a second. This really fits with what I've been telling patients for many years. I've used the term think heart healthy. In other words, what's healthy for your heart is obviously going to be healthy for you, but is a good guideline when it comes to moving your way through the therapeutic process. And it sounds to me like you're reinforcing that in the statements you've just made.
Yeah, I think that most of the chronic diseases have similar, the spark may be different. The susceptibility factor that might cause one person to develop heart disease and another person breast cancer, those genetic or environmental sparks or predispositions may be different. But I think in most cases, the gasoline that turns that spark into a raging fire is similar, and it has to do with how we eat and how we live. So,
Very, very, very good, Gordon. That sets the stage. So please continue on. Given how we've set the stage, and I love your definition of diet as the important soil in which we're working. Please continue on.
So think of a pyramid. The base of that, of the therapeutic order, of the pyramid of the therapeutic order, is the things we do to establish the conditions for good health. Often, a person will come in and see me, and maybe they'll present with one problem, and it just so happens that they've been having chronic headaches. They didn't complain to me about the headaches, but they're there in the background. If they had gone to see another doctor, the doctor might have medicalized that problem, worked them up. Maybe they would have ended up having some type of radiologic exam or blood tests or whatever, and they would have found the cause and treated it. Now that patient sees me for a different issue, changes his or her diet to help that other problem, and the headaches just happen to go away. They never had to be medicalized. They never had to be turned into an expensive proposition, because the same dietary factors that are the driver for one thing often are the driver for something else.
Well, that's a beautiful explanation. Now, Gordon, often I, as a surgeon, is one of the first people that newly diagnosed breast cancer patients are referred to. Mm-hmm. I tell patients several things. One, time is our friend. Two, we have multiple options potentially for treatment. Three, we're trying to set up a comprehensive approach. In other words, whatever we do surgically, whatever we do, if somebody needs chemotherapy as an example, or anti-hormonal therapy, are some of the short-term approaches that we're going to do. But then there's the long-term survivorship. So let's sort of dissect each of those from your approach now. What practical advice should we give somebody, as an example, who may be facing breast surgery with me in another week or two?
So I want to come back to that, but I just want to complete a couple thoughts about the order.
Okay.
I didn't quite convey that when we are not able to address a health problem sufficiently by establishing the conditions for health, that's when we move on to a more targeted kind of treatment. We use less invasive, targeted treatments, natural therapeutics if possible, physical therapy, perhaps In my realm, we might use nutritional supplements or something else. When that's not sufficient, allopathic medications, and eventually we work our way up and we may need surgery or some kind of intervention where the doctor takes complete control, beats the heart for the patient, breathes for the patient. And the thing is, if it's a real emergency and time is of the essence, you don't start with establishing the conditions for health.
Sure.
If I'm in a car accident, if I want somebody to get me to a trauma center,
right,
straight away, this isn't the time to counsel me about, gee, are you taking the right diet or herbs or whatever.
Right.
Similarly, when it comes to treating a condition like cancer, if it's genuinely an emergency, if there is a vital function that's blocked or interfered with in the patient's life or is in danger, or they're suffering severe debilitating symptoms, that's not the time to focus on, diet.
Uh-oh. Gordon, oh no, we have frozen. Oh my goodness gracious. Are you there, Gordon?
I'm still here.
All right, you froze right in the middle of saying, if we have an acute emergency, that's not the time to work on diet.
Have I unfrozen yet?
Yes, you are unfrozen
okay,
now.
Just keep going.
All right.
But if you're in that kind of a crisis, and I hope that we are unfrozen and everything is flowing now.
Yeah.
If you're in a crisis, then that's not the time to be focusing on, building health from underneath. That's the time to deal with the crisis and in the best way possible. And so when it comes to cancer, that means if we need to use an eradicative approach, removing a tumor surgically or addressing it with chemo or radiation, so be it. We want to do that as non-invasively as possible, but we want to do it as effectively as possible. Okay. Once the crisis is resolved, once we've done that kind of treatment, then what we want to do is return to the therapeutic order, which is really applies to when a patient or an individual is in a protected and safe place. But when there's a crisis, that's not the time.
Yep. So we've got a few minutes left, Gordon. We're going to probably try and limit us to around 20 minutes or so. In this last, 3-4 minutes or so, your points are absolutely phenomenal and really important. But let's go back to my question. I'm now seeing somebody, a good example would be somebody who doesn't need chemotherapy up front, simply needs a lumpectomy, sentinel lymph node biopsy, whatever it may be. We always worry about the side effects of a general anesthetic, a little nausea, things of that sort. But in this day and age, those are pretty minimal. What can we do to set that patient on the road to this building that base, if you will? Because that same patient may or may not require chemo down the road, may or may not require an anti-hormone therapy. So how can we counsel them as far as getting that base ready? I'm going to do surgery in a week or two and other things are going to follow.
I think it's really important to help put things in context for a patient. In other words, to let them know that while we're treating something as an emergency or as an acute issue temporarily, the person's life is probably not going to totally hang on this one thing. And what really matters is the long run. How is this person going to live and be healthy and happy in the long run? So it's kind of a reframing. Yes, we need to address and deal with the problem that's immediately at hand, but that's a small part of the overall picture of this person's health. And to do that, we want to do things like encouraging them to take control in all the places where they really can. Yes, of course, they have to allow the surgeon to operate on them, and that means, for people, the difficult task of relinquishing control.
Right.
But when things turn, and the time will come, they need to be reassured that things will come back and will be within their control again. And at that point, I think they need to be encouraged to do everything they can to help themselves and to reclaim control so that they feel like now they're in the driver's seat of their life.
Yep. No, fair enough. Any sort of, again, I realize that nutritionally, people aren't going to change that base that much if their surgery is a week or two from now. But any sort of short-term recommendations you would give, dietary-wise, food-wise, that you'd give to patients getting ready for surgery?
Well, I think that what's most important in that moment is to be as healthy and worry-free and calm as possible, because I think it's a longer process to really overhaul and change one's diet, and a week doesn't afford, or a couple of weeks doesn't afford that opportunity. So I think what's most important is for a person to be able to go in there with a sense of confidence that this is going to help them, that they're exerting the control they can, which is making the wisest possible choice about who's going to perform the surgery on them and what procedure they're going to have. And then once they've made those decisions, then put out of their mind as much as possible the worry, the anxiety, and just focus on getting through that, getting through it as whole and as healthy as possible, and knowing that on the other side of all of that, there'll be the time will come, and probably a lot faster than they even think, where it's now going to be back in their control. And
fair enough.
And I think that when people can see it that way and frame it like that, they can then begin to take the reins of the whole process and not feel out of control.
You know what? That's a beautiful way to wrap up this interview. One of the things that I have shared with patients for the last 30 years is that they be involved with a multidisciplinary team. You know, in other words, surgeons, radiologists, pathologists, medical oncologists, radiation oncologists, physical therapists, and yes, people like yourself in integrative medicine are part of a really important team approach, because I think that does, Gordon, give them the sense of empowerment and the ability to let go and to turn things over. Needless to say, when I meet a patient for the first time, they're like the proverbial deer in the headlights. They're scared to death. They've heard the term breast cancer and they're freaked out completely. And so one of the things we're really trying to do is to take control of the situation. Only in live TV like this are we getting phone calls coming in, and I'm going to wrap this up. But your points are extremely, extremely well taken. Well, listen, we're going to wrap up this interview. Hopefully we're broadcasting okay at our Breast Cancer Answers Facebook page. That particular call was from Christina, who works with me at Wirebuzz. Gordon, we're going to look forward to having more interviews with you as we go down the road and to really build on what we've been working on here today, okay?
My pleasure, Dr. J.
This is Dr. Gordon Saxe, MD, PhD, or if Gordon wants to put it the other way, PhD, MD. He's really a fantastic guy. Stay tuned for future broadcasts. Hopefully this one has gone well, and we look forward to doing more. I'm Dr. Jay Harness from Breast Cancer Answers. We're here for you. Here's wishing you all of the very best.